Hello and welcome to the Scottsdale Living podcast. I'm Dr. Amber Enright. I'm a doctor of physical therapy and the host of today's episode. And I'm sitting here with my friend and our guest, Catherine Marben. She owns Profile Aesthetics here in Scottsdale, Arizona. And I wanted to have her on because it is a trending topic to talk about fillers, the fountain of youth, what my face looks like, especially here in Scottsdale. And people actually travel here from all over the world to get regenerative medicine, to get aesthetic work done, to get plastic surgery done. We are becoming quite a mecca for these services. And there are thousands of businesses here, essentially in the Valley, that do some form of youth maintenance.
That's right. Yeah. The mini LA, they say.
Yeah, the mini LA. I love that.
Yeah.
And so it's not always what people think. You know, when I was growing up, I come from a small town in Arizona, like there was nothing aesthetic. You know, there were no services like that. And so it was all about like what your natural body looked like was the way that you were supposed to be appealing to be. And I love that messaging. So I have some questions about why aesthetics for you.
Yeah. You know, for me, I've been a nurse for almost 20 years now, and I've always been in primary care, learning and development. And we moved from Minnesota here to Arizona. And you know, thinking about tapping into how can I help people with my degree that I have, with my artistry that I have, and in a way that I get to control the patient experience. So this is when I thought, you know, I'm going to do the training to become an aesthetic injector and open my own place. You know, as I looked around for places that would accept a new injector, I realized that for me to control the entire patient experience and outcome, I had to open my own.
Okay, I love that. And what about like messaging for women on, because now I'm 38 and I'm like, oh, wow, I have wrinkles. Like, is Botox for me? Should I get my cheeks filled?
Yeah.
Like gravity wins, right? Like in
Totally.
the end, gravity wins.
Yeah.
And so, you know, I think that, and this is real, I work with a lot of like geriatric patients or people essentially in a phase of life, and they look at their partners and they tell me, I still see her like she's in college. And sometimes we look in the mirror and we're like laughing, like, oh my gosh, we're old. Like what happened? And I think it's beautiful that we all have this notion that we're in our 20s or 30s. In our mind, that's what we look like. So what is it about aesthetics that like pulls you to like help people in this way? And is that how you see it?
Totally how I see it. I think that, you know, when you can have a whole room full of women that have had procedures, you're only going to notice the bad work, right? The too much work. So it is that, you know, that is something that I pride myself on, responsible injecting. So just like you said, you know, we're getting a little wrinkle here. 38 is definitely the age that I start seeing people like, I don't know what happened here. But it's one of those things that, you know, when I speak to somebody, I'm always looking for your best features because that is what we want to highlight. That is what they've had their 20s and 30s loving about themselves that they see change, right? So I think it's just so important to hear them speak, identify what they think of in their mind, as you were saying. Where's my lips? You know, they're losing volume, or my cheeks used to do this, or my jawline. And then really just bring them back to their baseline, I think is so important, and not go overcorrecting things. So saying no often, we say no often, or we say, listen, enough filler, which is the phase, you know, more regenerative, your own body making the collagen to perhaps give you mild volume and shaping. That's the way that this is kind of going.
Okay.
So definitely bring back that confidence from your 20s, but let's do it responsibly, slowly, and quietly.
I love that. Responsible aesthetics that also enhances regenerative. So when we're talking about regeneration, you know, obviously I want my skin to look like this forever. You know, and when I think of, you know, what the aging process does, I do know that like I'm losing cells that help provide the lift, that help provide the bounce, the texture, the firmness of my skin. And then essentially how smooth it looks and that kind of like radiant glow. Now, I
Totally.
can do a lot of that with makeup. Like, look at me. I'm here for the makeup.
Yeah.
So when we're talking about how my skin naturally does that,
Yeah.
the only things I know about are collagen and elastin. What are you doing these days to help people produce collagen and elastin? And is that really a thing? Like, I've drank liquid collagen. I honestly didn't see a difference. I did it for 30 days. I didn't really see it. Maybe I did, but I took the before and afters and I was like, kind of the same.
Yeah. Yeah, exactly.
So tell me what you can do for that.
Well, I think it's really important to, first of all, note that you can take all the collagen or the nutrients or whatever they're saying is going to do that for you as you want, but your cells have to be open to using that. And so how do we do that? So, the things that I'll touch on today are ways we can manipulate the cells to actually act younger, which is pretty incredible. There's a lot to still study, but many of my friends and colleagues are already on it. They've created beautiful papers. We actually just had Toscani Medical FDA approved this year. They are a business that has been around for 40 years that create polymicronutrients. And so where these nutrients go, they give your cells the revitalizing cocktail that they need to act younger. Our cells, as we're exposed to free radicals, UV light, pollution, they are losing these things that create our collagen, fibrin, and elastin. So how do we, rather than injuring these cells to create the healing cascade that creates collagen, we injure them these days? Chemical peels, microneedling, lasers.
Really?
And so when we injure a cell, it creates the healing cascade that we're looking for. So this is a controlled injury.
Okay.
That healing cascade goes through its 4 phases, equaling collagen in the end.
Okay.
Strengthening tissue, giving elasticity back. This is what kind of reverses the aging, if you will.
Mm-hmm.
So regenerative aesthetics is changing the mindset of, let's stop damaging ourselves and let's care for ourselves. How can we feed them what they need to act younger rather than induce that by damaging them?
So this is not on the I'm taking a drink of collagen. This is on the skin surface treatment level. Yes?
Correct. Many of this is surface level. Exosomes right now are just FDA approved for surface treatments. Other countries are injecting them.
Mm-hmm.
We're not there yet here. So you're talking about topical or you're talking about microneedling for exosomes.
Okay.
But things like Sculptra, Radiesse, PRP, these are injectables. So I actually lay them under the skin just like I would a filler.
Okay.
Mm-hmm.
Okay. And when you do that, are we talking about the volume that you would need for an injectable filler, like cheekbones, and then you're using something to like bring it toward the skin? Or once it's in there, it kind of does its job over a certain series of time? How does that work?
Yeah, that's a great question. It works differently for most products, but I can say, when I'm doing a full face Sculptra treatment, so our plasma sculpt treatment is the most popular one that we do. It's full face, temples, cheeks, under eyes. Some people need the PRP directly into the tear trough, people that have a little volume deficit, or perhaps you can see discoloration of that area, jawline, chin, and nasolabial fold.
So, and this is a filler or it's a skin treatment? Which one?
It's a biostimulator.
Okay.
Wherever the Sculptra is laid, it will permeate the tissues all the way to the surface. You'll get a beautiful skin glow. But what's happening is...
So I need this.
Yes. Yeah, everybody needs this. What's happening is the synthetic PLLA is what it is for Sculptra. The synthetic materials stimulate the immune response in the body that creates collagen. So we're just chasing this inflammatory process that brings us the 4 phases that equal collagen at the end. There's so many different ways to do it. So Sculptra, wherever we place that, we mix PRP in with it for the plasma sculpt procedure. It's just a double bang.
And that's from your own body, right? So
Mm-hmm.
what do you do for PRP that's for like a facial?
Yeah. So we would draw your blood and spin it in a centrifuge. And so, not all PRP is considered equal. There are test tubes and centrifuges that can get your baseline PRP to 2 times its normal level. When you have a medical grade system like ours, it's the same one that an orthopedic surgeon would use.
Okay.
We can get your PRP levels to 10 times your normal baseline.
So what you're also saying is not every office uses that same quality of equipment.
Absolutely.
So as the average bear walking into a clinic, how do I know? Like,
Yeah.
how do I know who's good? How do I know who's not good? Like, what are the things I'm actually looking for in this office that make me want to trust? Because like I said, there's a lot of clinics that say that they do a lot of things.
Right.
And some of them I walked in and I'm like, I don't know, this isn't really for me, but the front office is beautiful.
Right.
And so how do I know if that person is, I guess, even qualified or they have the proper equipment? What am I looking for, Catherine?
It's a great question. I think that needs to happen before you walk in.
Mm.
So I'm currently writing an article for Scottsdale Living right now, how to choose an injector.
Mm-hmm.
As I was writing it, I had to ask my husband, is this sounding a little negative? I don't mean to, but there are so many things to look out for. So, in this state, Arizona, you have to be a licensed professional, so registered nurse or above. And the qualifications to be an injector are taking a 2-day weekend course that includes didactic with a demonstration at the end of what you learned.
Wow.
So in short, you take a quick course, you may inject. And so what makes somebody stand out from the other would be continuing education. This is above and beyond the education that the reps will provide. They love to have new injectors that they really believe in come to their events, and they're wonderful events. But it's different when you have mentors that are well-known and established. Some of the best mentors in the world who I've been with and spent one-on-one time with to really give you the tips and tricks and talking off-label, which you don't get at these representative meetings. So you're really kind of getting the behind the scenes. So I think just the reinvestment back into the industry, number one, you should be able to see that on their website or on their Instagram.
Right.
That's where I would start.
I actually like that you said, I'm writing an article and it's not like all sunshine and butterflies.
Yeah.
And I think that I like that because I truly believe, and I hear people losing the critical comparison quality of things. And I think what that means is like anything great probably also has some pitfalls.
Absolutely.
And you kind of have to like think of that.
Yeah.
Now, I guess I'll share my personal experience. I did have injectables in my lip once. And it left me with a wrinkle afterward. And also I had a terrible reaction to filler. So it was terrible. They had to go in with this other stuff and break it all up and essentially reduce what I had.
Sure.
But I noticed that after I had filler, which clearly there was probably way too much also, I have a permanent wrinkle in a side of my lip.
Sure.
I don't want to do anything about it, but people don't talk about the negative impacts of something that we're putting in our face and maybe we're trying out. And obviously there are risk factors. Obviously we want someone who's experienced. We want someone who will try and graduate us up instead of going like full front and see how our body responds.
Yeah.
Like when fillers first came out, everyone had a big duck lip, upper lip. Everybody had it. They had a huge flip. Everyone had it. And it was almost like you're kind of staring at people. You're going, that's not natural.
Yeah.
What am I looking at? And then like really, I think even the world of aesthetics was kind of figuring out where is the filler going to be placed so that it doesn't appear that way.
Correct.
And so, you don't really want to be the guinea pig for that. So like you said, thousands of hours of experience need to be on board. Is there a way for people to look up when people got their certification to be an injector versus when they were licensed and how much experience they have?
There's not like a streamlined way for that. So I think for maybe a social proof is to be looking at their before and after results on social media. I think it's so important. And I don't want to say that there's not wonderful providers out there that perhaps just aren't great on social media. I'm sure there are. But for me, I wouldn't take the risk of not seeing many and many and many consistent results showcased. It could be a red flag of perhaps this person just doesn't have many clients. You wonder why. Or perhaps they do, but they don't have great results. And so that would be kind of a first red flag for me. A lot of what you just described is injection technique. they're not familiar with the true anatomy in all the layers of the face. The textbooks are 2D. So it's going to tell us the 5 main layers of the face, when indeed in the temple, there's 13 layers in the face. So, finding somebody who has done a cadaver course, they've dissected a cadaver to see these layers, not once, but several times. That's important. What have you done? Do you understand?
Thought about asking that question.
Absolutely. And why would you? When I feel like aesthetics is presented to the public, it seems like a very easy, streamlined process.
Well, it's consumer driven. It's like I'm going to the grocery and I either go to AJ's or I go to Fry's.
Yeah.
And really, we're talking about something completely different. We're talking about how the fruit is grown, not what's on the shelf.
Yes. And it's not just the maybe injection points that you see on Instagram. It's the injection points and all the layers. And you have to have these products in the right layers, or you're going to find side effects such as what you found. So again, that education is just so key to be able to keep the result artistic and safe.
Okay. So we talked about licensing. They need to have extensive training with experts in the field, training with expert level providers, hours and experience, like how many clients has this person seen. I actually want to point something out.
Yeah.
So you're on here for Profile Aesthetics, but you've been in the industry essentially for 20 years and you're just rebranding. So if people look up Profile Aesthetics and they're like, oh, this is a brand new company, essentially it's a rebrand. So I kind of want to make sure people look at that.
That's great. Thank you.
And no problem. So what about for other areas of aesthetics? Like we essentially talked about face treatment, under eye treatment, filler and lifting through Sculptra. What are other areas there that you're like, women are always or even men are always coming in for this? This is a primary concern. Almost everybody has it.
Yeah.
What is it?
Yeah. Well, number one, it just has to be a neurotoxin treatment. So wrinkles in the forehead, the 11 lines, and crow's feet. These are the most popular 3. They call it the entry drug, right? We talk about Botox a lot, the name brand. There's other brands out there that, in my experience, are surpassing the longevity of Botox these days.
Like, you mean it lasts longer in the face?
Yeah, absolutely.
So it's becoming more popular?
It is, yeah.
I tried some and they felt like the effect felt natural. And I was like, there's not enough paralysis here.
Yes, exactly.
It's crazy.
Yes. No, I think too, setting expectations. So that can happen. And that can happen to a really wonderful provider who doesn't want to give you a max dose right away because perhaps they're just meeting you. It happens to me all the time because I tell my people, I want to find the smallest dose that works for you. But what that means is you might have more movement than you want in 2 months. That just lets me know we need to bump up that dose. So just letting them know why we're starting small, set the expectations so they're not surprised and feel like it didn't work or something else was wrong and go elsewhere, right? So I really try and do that with every treatment, just full honesty. This could happen. I need to get a block of wood in my office and knock on wood. It hasn't happened to me yet, but it could, and even the best injectors, expect touch-ups.
Yeah.
Expect to have to take care of your clients. I think it's so important to be willing to open another syringe. I've had several clients say, this went wrong at another office and I called them and essentially got chewed out, or they didn't want to see me, or they think I did something wrong after, or it just kills me to know, like, you got to take care of your people, So just knowing and practicing in a way that I can open another syringe and help you, or I can take that spot out if it settled wrong. These things happen. It doesn't mean that it was placed wrong. After you leave the office, things change. The heat, you're sleeping one way, you exercise, your body
reactions.
Exactly.
Like I had no idea that I potentially could be that person.
Yeah.
And I did some research because I actually had random swelling for years afterward. And so I had to look up, like, what is the incidence of this? I would just wake up and half my mouth was swollen, only on half.
Yeah.
I didn't realize that there was like some barrier between the left and right side of your lips.
Yeah.
It's kind of strange, right?
Yeah.
But yeah, so there's obviously risk anytime we put anything external into our bodies. Every needle that has an injection point has risk for infection.
Exactly.
Even if people are using sterile procedures. But it is obviously important to know that who you're going to is a trusted provider.
Absolutely,
Yeah.
too. I think just to piggyback off of that, just a little piece of information, it's so important, is how dangerous that getting filler really can be.
Mm.
Any of that filler gets into a vessel or an artery, you can have what's called an occlusion. It blocks blood flow. If it gets into the right one, it could cause immediate blindness. These are things the public doesn't talk about. And so when you see unlicensed medical professionals, I see a lot of lash technicians buying the Hyaluron pen on Amazon and injecting noses, lips out of their homes.
Wow.
They don't have an emergency protocol for you. They don't have a medical director over you. They're not a licensed professional with a malpractice to help if needed. So these are things that are just so important to choose somebody who's ready for that, ready for an adverse event.
Yeah. I think that, again, people really, instead of baby birding off of Instagram ads, really have to do their research, especially. Yes. I get it. A lot of times it comes down to like cost. They're like, well, I'm not going to go to my plastic surgeon for this because I'm going to pay $5,000 more, which they don't know because they might not have done that research.
Correct.
Versus a nurse injectionist or versus this person who has not any form of medical or healthcare degree. And yeah, that can be definitely a scary situation.
So scary.
Okay. So other things that you actually do, and this is interesting to me because my whole family has bubble butts except me. I was like the stick growing up with long hair.
I love it.
So I heard that you do like, thank goodness for the blooming.
Yes.
But I heard that you guys do like booty sculpting.
Yes.
And like hip dip filling. Like,
absolutely.
I have a girlfriend that she's so gorgeous and she is so self-conscious of the hip dip. And I'd never heard it before.
Popular.
I had this friend. I just wouldn't even think about it.
Yeah.
And so tell me, what is that process? What the heck are you doing?
So there's two things that we use for that. Sculptra is one of them. And then Radius is the other. Both of those products I just named are biostimulators, meaning wherever they are placed, it's going to create a reaction in your body that builds collagen. It's a slow process, but it's a process that ends up being your own natural tissue. So we can fill those hip dips. We can shape the booty. You get a little bit more shape with the Radius because it starts with gel microspheres. So it is essentially like a filler.
Okay.
Rather than Sculptra's more like a watery consistency. In 3 days, that water will be gone. You'll wonder what you just paid for. And now you got to wait, you know? Radius gives you that shape right away. You have gel microspheres that act as a filler. And then over time, the spheres are replaced with your collagen.
Okay. So these spheres, is it hyaluronic acid or no?
It's different.
It's different. Okay.
Yeah.
But they are hydrophilic, like they pull water in from your body what?
So you're right. Hyaluronic acid is hydrophilic, pulls water in. So choosing
to hydrate it anyway.
Exactly.
Then still look great.
But it just a tiny blip, it's important to choose the right filler for the right area, right? We wouldn't want something carried a bunch of water in the tear troughs. So we have to pick the right filler for that. But no, this is called CAHA is what we say for short. And that's Radius. And these are actual just gel spheres. So calcium hydroxyapatite is what CAHA stands for. And so not HA. And then that is what stimulates the body's response, create collagen. And the gels act as like a matrix for the collagen to attach to.
And how much, is this still sold in like syringe volume? Is this much bigger? Like I'm looking at like, for lack of a better term, like, like a small breast implant kind of like amount.
Yeah.
And what timeline or how many treatments do people really start seeing, I guess, volume, or is it less?
That's a great question.
What am I getting here?
So with Sculptra, I know it's a great question. So Sculptra, several treatments. 2 to 3 is what I usually recommend, depending on our goals here. And again, that's a very slow process. You're going to begin to see results at roughly 8 weeks.
Okay.
But the great thing about it is studies show it continues to build your tissue for 2 years and beyond.
Wow.
So when you look at the research, it's 2 years in the research, but they had to stop that and get it on the shelves. But I have
Mhm.
some mentors that have continued to do their own research, and they show beautiful results even at the 4-year mark.
Can you use that for like here?
Yes,
If you are like losing volume or starting
absolutely.
to notice like drooping in the décolleté.
Yes, the décolleté. Yes, we can definitely, the lines,
Uh-huh.
the texture that happens with time. Absolutely. So that's a
Oh,
great way to kind of keep that revitalized and fresh. I would definitely add some PRP in there as well. But Radiesse and Sculptra are very popular in the décolleté. Radiesse and PRP in the neck.
mm,
And then when we're back to the booty sculpt, if we used the Radiesse for the booty, that's more like one treatment even. So yeah, the
wow.
prices can end up about the same. But people are more satisfied with the Radiesse and the booty because they get the immediate results, if you will.
Mhm,
It doesn't just go away and now you got to wait for it to build.
mhm.
But you're right, depending on how many, it goes by syringes. But when we're talking about the booty and we need 20 syringes,
Wow.
clearly we need to package this.
Mhm.
So yes, the price can be anywhere. I think in the Valley is maybe $8,000 to
For the
$10,000
booty.
for the booty.
That's 20 syringes.
Hmm.
And that's like essentially a discount price, like with better packaging for the syringes
That
because they're
is.
getting a volume.
Yeah. And that would be,
Wow.
and Sculpture slightly less than that. I would
Mhm.
say in the Valley, maybe a $5,000 to $7,000 range
Okay.
per.
Mhm.
But yeah, so it certainly can be. And then of course, hip dips. Now we're just talking about, a smaller amount. So
Mhm.
that'll be per syringe likely.
And with something that could potentially last up to 2 years, that makes more sense. Whereas a lot of fillers, you're looking at kind of like 4 to 6 month mark. A lot of people are going in at that 4 month mark, kind of to touch things up that aren't quite
A little
as.
touch up. Yeah,
Mhm,
many of the fillers have it up to a 2-year indication.
mm.
I would say 15 to 18 months. But
Wow.
I always tell my clients, we may have to use several syringes up front to kind of get back to your baseline
Mhm,
where you're happy. And then don't let your gas tank get back down empty.
mhm,
Just come in, expect an annual, just kind of top off, excuse me.
mhm, mhm.
You know, and we get to a point where the structure is beautiful. We just need a spot treat.
Yeah.
And you can take one syringe of the right filler and do many different areas with that.
Okay, so personal time. What do you do? You're gorgeous. You look
Oh,
like you have 0 lines. I
thank
don't
you.
even wanna ask your age, but what are the things that you're like, "My face does not go without these
Yeah.
things. This is my beauty regimen. This is annual. This is monthly." What do you do?
So one thing that I do for sure is neurotoxin, and that's just a general term for Dysport and Jeuveau is what I love in my
Mhm.
office. We also carry Botox and Daxify as well. Every 3 months. I'm nearing my 3 months, and while I have a little movement, it's movement that bothers me.
Uh-huh.
So I'm waiting for that. Sculptra has to be annually.
Okay.
Radiesse in my jawline, and the polymicronutrients from Toscani is always mixed in with both of those,
Mm.
and PRP. So today, actually, I'll be having a PRP treatment under my eye and
Mm.
cheeks, and likely the PRP lift because the amount of PRP we're able to get, we can do a full face. So just at cheeks, chin, jawline, these areas that just a little bit more volume and glowing
Mhm.
changes a person's whole face without somebody saying, "Ooh, you had some work done."
Uh-huh.
Yeah. So I would say though, Sculptra, PRP, and neurotoxin, and a little Radiesse in the chin.
When do you recommend that people start kind of thinking about the anti-aging process for their face? Like at what age? Or is it so different for people? I
So
mean,
different. It's
yeah.
so different. Here's what I say. I've had many men, especially, challenge me. Well, what if I like the wrinkles in my face?
Mhm.
Then I say, then you are where my clients want to be, and that is confident.
Mhm.
So, when to start thinking about these things is when it's affecting your daily life or your thought process.
Mm.
So that does change. I've had somebody who's 26 come to me and say, I never really thought about this very deep line in her forehead because of the way she pulls. She said, but I'm newly single. And I was out last night and somebody at the bar, a man at the bar, talked
No.
about her and it just
Oh my
crushed her.
gosh.
Yes. And so these are the things that I'm trying to help with the confidence.
Mhm.
And so it was just a tiny amount of product that it took to just boost her right back
Mhm.
to confident.
I mean, every single person has something that they feel self-conscious
Right.
about. And you're right. I think that it is a beautiful thing that you can give somebody It's honestly very simple.
Yeah.
It's very simple.
Yeah.
For most people, some level of this kind of confidence booster is fairly affordable or
Right.
something that they're willing to invest in.
Yeah.
I mean, there's obviously things too in aesthetics that are fairly unaffordable,
Correct.
more than your car payment or your mortgage.
Right.
Like,
Yes, there are.
fairly expensive.
Yes.
But I mean, I hate when people are looking at themselves like they're not worthy, like they don't have the same value as someone else sitting across from them because of something so primal as like a wrinkle.
Yeah. Exactly.
And I think anybody could relate to that. It could be a scar.
Right.
It could be anything. And that's such a sad thing that adults are still making fun of people. I mean, as kids, it's like, oh, they're going to build character. And I on some level, I believe that.
Yeah.
I believe I've got a lot of character from those things.
Yes.
But on some level, as adults, you're like, you want to walk into a room, you need to be able to be a business owner, walk in with confidence and like own it.
Yeah.
And it could be something small that holds you back like that.
Totally.
It's totally worth
investing
in.
I mean, the amount, I've had the most beautiful women come in, one I'm thinking about right now. And I'm like, the first thing I said was, you are so beautiful. Like, how can I help you? And I meant it. And she just cried.
Oh.
And I'm like, oh my, clearly she wasn't feeling that. I was like, I can't even believe you're in your 50s. You look beautiful. And it was natural. And that, she's like, but I don't want to do fillers. What can I do? So we put her on Sculptra and radiofrequency microneedling, and PRP, the most incredible, beautiful results. And she walks with her head so high right now. It's just incredible to have her come back and see that.
I love that. You got a little poster child in there.
Beautiful. Yeah. That is what just makes my day.
That's cool.
It's like so cool to see these people. I just want to throw in there too, because it is expensive. This is expensive. And I think probably the most inexpensive way that you could treat yourself and feel fresh and revitalized would be topical medical grade skincare, and just finding a spa that you really relate with, and perhaps joining their membership, getting those facials, regularly. It's not one thing; it's maintenance.
Okay, so laser facials. I've never tried one, and I've always been interested. Are those better than like the topical only facials?
Yeah,
I'm interested.
Yeah, I don't have enough experience with that to give a very confident, sure answer. I wouldn't say one's better than the other. When I think about a laser in general, you are risking things. You're risking the provider that's behind the laser, putting the settings properly for your skin type, the depth properly, and hopefully you come out of that with no scarring, no anything, that went wrong. So I'm sure they're beautiful. I'm sure they're not cheap. So I don't want to speak to that. I really don't know. We don't have lasers.
Well, that's a good point. I did have laser hair removal.
Yeah.
From 2 different places. And the second place, they kept getting new employees. And there were several times where I knew for a fact there was no treatment being provided. There was no treatment. And I called the owner and was like, I don't know what's going on, but I'm a regular here. I know what it feels like. I know what the post effects are. I know what it feels like while I'm getting it. There's no treatment provided today.
Right.
What do you want me to do?
Correct.
And to your point about like the follow-up and the customer service, not all companies are created equal that way. And they may not want to refund you or get you in for a second treatment.
Yeah.
I mean, I left a practice for that reason.
Correct.
Like they did everything in there and they did not address that concern. And I was like, no longer recommending your company, no longer doing business here.
Yeah.
Don't care what the discount is.
Right.
I'm not coming back.
That's right. You can't, you have to take care of your clients. In my opinion, don't go into business unless you're willing to take care of your unhappy customer. And that helps you sleep at night.
Yeah. And it's a level of responsibility for your business.
Absolutely.
Regardless.
Yeah, totally. So, just even if it's just $100 a month membership, you go get your little facial every month. It's the repetition, we're constantly exposed. And we need that cellular turnover. Keeping that happening is keeping your lines a little bit more shallow, a little bit less noticeable through time, and you get that freshness out of it. I think that's probably the most inexpensive thing you could do.
Okay, well, I'm definitely interested in coming in. You can learn all these things.
Yes.
So how do we find you?
So we are profileaesthetics.com. On Instagram, profileaesthetics __. And we are right in Old Town, just down the street from you, Main Street in the Arts District in Goldwater.
Okay, perfect.
Yeah.
Wow, good spot.
Right? Yeah, we
Wow,
love
all
it
right.
there. Yeah.
Okay, well, I'll come by
Yeah.
and check you out. I
Awesome.
really appreciate you coming on for your
Yeah,
expertise.
absolutely.
Thanks for sharing about your personal routine. I
Of
think that's a
course.
big hit.
Yes,
So
of course.
can't wait.
Anytime.
Yeah. And we will make sure that all of her info is tagged at the bottom of the episode. And if you need her again, her information is Catherine Marben with Profile Aesthetics. That has been today's episode of the Scottsdale Living podcast. Catch you next time.